Morning, doctors and friends. So today we from SGD B9 are going to talk a topic about dacryocystitis. These are the members of our SGD. Now I'll start off with the background. So dacryocystitis is usually characterized as an inflammatory state of the nasolacrimal sac. It's usually caused by an obstruction within the nasolacrimal duct and subsequent stagnation of tears in the lacrimal sac. So there's a bimodal distribution occurring in congenital or in individuals after the age of 40. And it's usually affects around 1 in every 3,884 births. And usually adults who are white are more likely to be harmed. And it's usually happen in females and has a low rate of serious morbidity and mortality. However, if it's not treated immediately and effectively, especially in congenital dacryocystitis, it can be severe and it can cause death. So the prognosis is usually favorable, in which you can use simple probing techniques, and conservative cases alone are known to improve the treatment very good. However, complications can be life-threatening. So the student project aims to help the medical students to learn and understand dacryocystitis so they are able to manage and treat the patients to avoid unwanted complications.
Hello, my name is Ferdinand with registration number 108. So about the formulation of the problem, it's about what is the definition, the classification, the risk factor and prevalence, the pathophysiology, pathogenesis, diagnostic, treatment, and also how to prevent the dacryocystitis. The purposes is to understand the definition, the classification, risk factor and prevalence, pathophysiology, pathogenesis, diagnostic, treatments, and also to understand the prevention of dacryocystitis. The significances, first, as the basic information about dacryocystitis for the future research, and the second, increased knowledge about dacryocystitis.
So my name is Anak Agung Rahparana Anatarifa, and I'm going to explain about the definition of dacryocystitis. Dacryocystitis is a common lacrimal system disease. Dacryocystitis is inflammation of the lacrimal sac, usually caused by obstruction of the nasolacrimal duct. Nasolacrimal duct obstruction can be inflammatory idiopathic stenosis or acquired primary nasolacrimal duct obstruction or secondary to trauma, infection, inflammation, neoplasm, or mechanical obstruction, or acquired secondary nasolacrimal duct obstruction. Obstruction of the nasolacrimal duct cause obstruction to the flow of tears in the lacrimal outflow system, causing the dacryocystitis. Dacryocystitis can be an acute or chronic infection. Acute dacryocystitis is characterized by the patient experiencing the sudden pain, erythema, and edema over the lacrimal sac region. The predominant symptom of chronic dacryocystitis is excessive lacrimation accompanied by mild signs of inflammation but rarely pain. Thank you.
As well, let's review student number 077. So, the etiology of dacryocystitis depends on the classification of the disease. They are classified into acute and chronic dacryocystitis and also congenital and acquired dacryocystitis. The first one, acute type, is caused by an acute infection of some pathogen such as Streptococcus species and Staphylococcus species. The chronic dacryocystitis can be caused by many other conditions such as systemic disease, dacryolysis, or any other condition that cause chronic obstruction of the canal. Apart from acute and chronic classification, dacryocystitis are also classified by the onset, which are congenital and acquired. Congenital dacryocystitis is caused by an anatomical defect that causes an obstruction in the Hesner's wall, and acquired dacryocystitis is caused by some conditions, which are surgery, trauma, medications, and also be caused by tumor or cancer.
My name is Kamal Denisa Paramita, last release number 98, and I'll tell you about the epidemiology of dacryocystitis. Dacryocystitis is more common at the age of 31 to 60 years old because productive age tends to be more likely to be exposed to infection, as does autonomy in the lacrimal sac in older age. Dacryocystitis occurs more in women, is about 53.6% compared to men. 46.5%. In women, hormonal irregularities affect the size of nasal lacrimal tract to be smaller and irregular lower nasal lacrimal channels, making dacryocystitis widely found.
My name is Nilan Vitasari, in 125. I will explain about the pathophysiology of dacryocystitis. So dacryocystitis occurs secondary to obstruction or blockage of the nasal lacrimal duct. In newborns, dacryocystitis can occur but rarely, called congenital dacryocystitis. This can happen because during embryogenesis of the eye organs.
My name is Angela Fatin Chavez with the last three-digit number 091. Now I'll explain about the pathophysiology of dacryocystitis, where my friend left off. During embryogenesis of the eye organs, the formation of canals and openings to the nasal cavity for lacrimal excretion, drainage of tears, and excess fluid are not formed completely at birth. Therefore, accumulation and prolonged fluid retention will trigger bacterial infection because it is a good medium for its growth.
My name is Haras, number 25. So, the sign and symptom. The most common symptom of dacryocystitis is tearing and discharge. In acute dacryocystitis, symptoms such as inflammation, pain, swelling, and tenderness appear in the medial tendon of the canthal lacrimal sac. In chronic conditions, symptoms usually include tearing and metering of flesh. And the more serious symptom of acute dacryocystitis are extension of the orbit with abscess formation and may progress to orbital cellulitis. If this occurs, it can lead to blindness, cavernous sinus thrombosis, and death.
Good morning, doctor. My name is Joseph Mesiwe, and I'll be describing the diagnosis of dacryocystitis. So the first thing would be medical history and checking for visible signs. The next test would be dye disappearance test, where the dye will disappear after a few minutes in the normal eye and will last longer if there is a blockage in the eye. The next test would be anti-neutrophil cytoplasmic antibody test, which can be used to determine Wegener's granulomatosis, while anti-nuclear antibody test and the double-strand DNA can be used to determine lupus. CT scans are done in cases of orbital cellulitis or extensive infection, while dacrocystography and plain field dacrocystogram are used when there's a suspicion of anatomic abnormalities, while the nasal endoscopy can be done to rule out septal deviation and inferior meatal narrowing.
The differential diagnosis of dacryocystitis include preseptal or periorbital cellulitis, which is a skin and soft tissue infection located in the anterior to the orbital septum, which is caused by sinusitis or trauma and more common in children. The symptoms are unilateral eyelid swelling and edema. Second is orbital cellulitis, which is muscle and fat infection located within the orbit of the eye, which is caused by Staphylococcus aureus or Streptococcus species, which is often affects children, and symptoms are eyelid swelling with or without erythema, ophthalmoplegia, pain with eye movement, and proptosis. The third is sebaceosis, which is a benign subepidermal nodule encapsulated and filled with keratin material and found in the face, neck, trunk, etc., and commonly occurs in the 3 and 4 decades of life and usually asymptomatic. And the fourth is sinusitis, which is inflammation of the sinus or cavity around the nasal passage, which can be acute or chronic, which is caused by various environmental and host factors. And the symptoms are facial congestion, facial pain, nasal obstruction, nasal or postnasal purulence, hyposmia, and fever.
Hello, my name is Ana Agung Ayu Ratindra Putri, NIM 174, and now I will explain about the differential diagnosis. The first one is neoplasm. This is a periocular basal cell carcinoma, which is the most common type. It is located around the eye, mostly in the lower eyelid. It is categorized as non-melanoma skin cancer or NSMC type. The several factors such as ultraviolet radiation, toxic substance exposure, and also history and other skin cancer from the family. The signs and symptoms are visible or palpable orbital mass, ulceration, and also bleeding. Next, there is lower eyelid ectropion. It is when the eyelid margin turn outward and eyes become dry. The signs and symptoms on this diagnosis is tearing and also foreign body sensation. It is very common in elderly patients. Next, there is dacryocystitis. This is the condition when there is an inflammation of the lacrimal gland. It can be acute or chronic. It can be caused by infection, inflammatory, or idiopathic causes. It is present with the lacrimal gland enlargement, erythema, and also tenderness in the supratemporal orbit area. Therefore, acute dacryocystitis is very common in children and also in adolescents. Thank you.
Okay, my name is Gabrielle, it's the number 169. I want to tell about management. First is conservative therapy. Warm compress and massage is the first line therapy. And we can give medicine like oral antibiotics such as amoxicillin or clavulanate, cephalexin or azithromycin. Dacryocystitis with complications should be given intravenously such as ampicillin or sulbactam, ceftriaxone, molfloxacin, and vancomycin. And the invasive therapy, definitive surgery should be considered in case of recurrent infection or chronic dacryocystitis that don't change symptoms after other invasive therapy. And we can do probing or balloon dacryoplasty or nasolacrimal stenting. Dacryocystorynostomy can be performed in recurrent dacryocystitis or refractory cases after probing or balloon dacryoplasty.
My name is Defastion number 146. I will conclude about the presentation. So dacryocystitis is a common lacrimal system disease caused by obstruction of the nasolacrimal duct, resulting in an inflammation of the lacrimal duct. By the cause, it can be classified into acute and chronic dacryocystitis, and while by the onset, it can be classified into congenital and acquired dacryocystitis. The disease itself can occur in both newborn and adults, where it's common in productive ages, age 31 to 60 years old, and in women. Common symptoms are tearing and discharge. To diagnose, doctor will ask for medical history to start pressing on the lacrimal sac to see whether pus will come out or not. Treating dacryocystitis can be in the form of medical and conservative theory. That's all from our small group discussion. Thank you.